For 26 days and counting, resident doctors in Nigeria have been on strike. Access to healthcare has now been greatly affected, as this has further compounded the existing problem of brain drain in the country's health sector. News of some Nigerian medical doctors undergoing screening for employment in Saudi Arabia at Sheraton Hotel in Abuja went viral on Wednesday, and TVC News was there to capture the event. Although some of the doctors were prevented from speaking to journalists by the screening organizers and hotel management, the exodus of even more doctors will plunge the health sector into a crisis. TVC News senior correspondent Femi Akonde has details.
A classic example of brain drain. These doctors are abandoning a failing healthcare system in search of better opportunities, as the condition in this critical sector continues to deteriorate. The organizers of this medical recruitment exercise are now trying to contain the backlash caused by an earlier TV news report on the exodus of doctors to Saudi Arabia. This time they have prevented us from openly filming the exercise that is seen as an embarrassment to the government at a time resident doctors are on strike and the fragile health system is still grappling with the crippling effect of the COVID-19 pandemic.
What we are saying here is that the timing is wrong and that the numbers are not right for our country. So we'll be calling on the medical association. In fact, I had a discussion with the president yesterday, and we're also going to be talking to other experts to see how we resolve the impasse. It should not be something we do because we are on strike or we are angry.
The latest World Health Organization ranking measuring overall health system performance for 191 countries puts Nigeria at 187, while Saudi Arabia, seeking to recruit more Nigerian doctors, is ranked at 26. This year's federal budget for healthcare is 547 billion naira. That is about 7% of the budget's total of 13 trillion naira. This falls short of African governments' commitment in April 2001 to dedicate at least 15% of their annual budgets to the health sector in what is now known as the Abuja Declaration.
But this particular government has done much for doctors.
The federal government insists the brain drain in the health sector is unnecessary or even exaggerated, as the President Buhari administration's policies, plans and programs have specifically targeted improving healthcare delivery in the country.
I do not also, as a medical doctor, agree when people are talking about brain drain and blaming the government all the same. Are we not Nigerians? Where is the patriotism? What is the cost of training a medical doctor in the United States or in UK? We don't want to go into all those. So let us let the sleeping dog lie.
To let sleeping dogs lie may mean to do nothing to stop healthcare workers who have lost hope in the system from leaving. Last year, the Nigerian Medical Association reported that out of 75,000 doctors officially registered in Nigeria, more than 33,000 doctors have left the country, leaving just above 50% of that number to man the health institutions in the country. Presently, resident doctors are still slugging it out with the government over some unresolved industrial disputes. But it seems it is increasingly difficult to find a middle ground, and the exodus of more doctors is inevitable.
These are issues that our association have envisaged for a very long time, and we have been trying to halt it long before now. However, because of lack of cooperation from the government, people have decided that enough is enough, and they have opted to go to claims that they feel their welfare is better protected.
The federal government may also have so much to handle, especially with solving insecurity, creating jobs, and improving an economy badly hit by the outbreak of the COVID pandemic. But it seems doctors have lost patience and they want out of a bad situation before it gets worse. Femi Akonde, TVC News, Abuja.
Joining me now to talk more on the reasons for Nigeria's medical brain drain and implications on Nigeria's health system is a medical doctor, or rather a public health consultant, Nnamdi Kanu. And also joining the conversation via Zoom is clinical pharmacist, Dr. Alera Roberts. Good morning. Thank you for joining us on TVC Breakfast. Okay, let me begin with you, Dr. Roberts. Let's get your reaction to this development at a time where we are faced with a pandemic and other health challenges, especially cholera. We are seeing this mass exodus of our medical personnel.
Good morning. Thank you very much for having me. And may I correct you? I wish I was a clinical pharmacist, but sadly I never passed those exams. I am not a clinical pharmacist.
Right.
I'm a public health physician. I'm the second vice chairman of the Association of Public Health Physicians of Nigeria, Lagos State chapter.
Right.
So I will be speaking as a medical educator, a teacher of many of these medical doctors who have been a teacher for 20 years in the medical school. And I have very mixed feelings listening to Femi Akonde's report as we came into this. I have very, very mixed feelings. On the one hand is the vicarious pleasure that as a medical educator we have trained people to such a high level that they are being courted by the high-income countries of the world, including Saudi Arabia. That's the vicarious pleasure that I have, but at the same time, it is clearly evident to everyone that it is having a huge impact on our health sector, on our service delivery, and has been doing so for a very long time. This is not a problem that started yesterday. This is not a problem that started under this administration. This has been an ongoing issue that has steadily been ignored. And I think it is very clear that when you listen to the performance of the Nigerian government since 2001, since the Abuja Declaration, you can see why that is. How can we commit to 15% of the budget going to health and consistently deliver less than half of that and expect a health sector that's going to respond to the needs of Nigerians? I mean, it just doesn't make sense. And I cannot believe that there are people in the administration who can't see this as clear as day. I'm just aghast, and I'm really saddened about this. I know that I'm still here only because I've been here for so long, but I cannot, in all good conscience, train a young medical professional, watch him or her struggle to meet their daily needs, how to get to work, how to feed their family, how to send their children to school. And when they are offered the chance to do so with some degree of comfort, as well as complete job satisfaction in what they're doing, stand back and say, no, where is your patriotism? I mean, this is just totally farcical.
All right, let's bring the conversation to the studio now. Nnamdi, talk to me from your point of view. We're talking behind the scene, and I asked a question. Are you also looking at going out of the country to practice? What are the implications you see with regards to this?
Well, to be really honest with you, sincerely, if I have the opportunity, I would also go.
What's holding you back?
Well, basically, what's holding me back is the fact that I have a foundation I'm running, and this Trinity Healthcare Foundation, and I want to see how much impact I can create before I start looking for my own satisfaction. But I would say that I can't blame any single healthcare practitioner leaving this country, given the welfare system in this country for doctors. Like my colleague rightly said, you realize that there are a lot of people, a lot of medical doctors who can barely feed. There are a lot of medical doctors. The other time I was having a conversation with somebody, I said some medical doctors in this country are paid as low as 60,000 naira a month. Some of them are paid as low as 50,000 naira a month. A medical doctor who has to work around schedule to make sure that he or she saves life. Where then is the compensation? It is in this same country that a health minister said that he doesn't have an idea about what we call health hazard allowance for doctors. It is the same country that a health minister said that is it not just temperature they are checking. These are things that we do not want to hear. These are things that when you want to save your nation, when you want to save humanity, according to Hippocratic oath that we all took, then you realize that you have an empty stomach. I'm not sure there's anything much you can do about that. Like my colleague said, Nigeria signed to the Abuja Declaration that mandate all ECOWAS countries to earmark at least 15% of the annual budget for healthcare. So that would, Nigeria has never achieved that till this day. In fact, we have never achieved 10%. And this was just like the lower benchmark, so that from there we can have money to take off personnel, healthcare personnel. We can have money for health commodities. We can have money for health facilities. Unfortunately, that has not been done. And you see the healthcare system going down by the day. We are fighting COVID-19 now. We are handling cholera and many other epidemics. This is the worst time for us to see the exodus of doctors the way it has been. So honestly, for me, yesterday when I saw that video, I was literally shedding tears. I was wondering where the country is going to. Are there no ways we can better handle this? I mean, the healthcare industry across the world is a robust, it's a multi-trillion-dollar industry. How can we rearrange? How can we prioritize, set our priorities right, so that we ensure that the healthcare of Nigerians is protected? And let me say this. Healthcare is part of humans' fundamental rights.
Absolutely.
And it is the duty of the government to take care of the right of its citizens. And so it is the duty of the government to ensure that the health care of each of its citizens is well taken care of. And what I'm saying here is a complete aberration from that. So honestly, I feel sad, but I tell you what, if I have that opportunity, I'll leave. Because there's no way I can serve humanity with an empty stomach. It's not done.
Right. Let me come back to you, Dr. Roberts. Health is a fundamental right. And the question is, how did we get to this point? I mean, one would say that these people, those outside the country, see something that it seems we in this part of the world are not seeing in our health care personnel. And I'm wondering, how did we get to this point?
I wish I could answer that question, but I mean, I think you will have to turn to the historians and the sociologists to really do a deep dive into what has happened in this country since 1960. And I'm strongly opined that the militocracy years of which this the present president is a part of, contributed largely to where we are today. I recall being in secondary school when he first came into power, and all you heard was the sacking of top-class civil servants on TV and radio. That put a huge dent in the civil service, and it meant that people went into civil service subsequently after that only looking at what they can get out of it and not what they can put back. Ever since then, we had seen the steady decline of the education sector. With the steady decline of the education sector came the steady decline of every other sector, including the health sector. So what we have now, because we're medical educators, and we're saying this thing and everybody's saying the doctors, the doctors, the doctors. We are not mentioning that the nurses have been leaving even faster than the doctors, the physiotherapists, and the pharmacists. Because whether we like it or not, education is, we do train to a really, really high degree. And once you pass an internationally accredited examination, you are skilled to work anywhere in the world. The one thing that is globally transferable as a skill is health service. And once our people pass and go, that's it. They get into a climb where they're able to work, where they have job satisfaction, they're able to meet their daily needs, they're able to send their children to good schools, they're able to give their children. I mean, I recall painfully one day when I was standing on the corridor in my department and a just newly minted consultant, just passed her exams, came to me and said, "Ma, please, I'm leaving, and we're going to be on the plane in a week, and I need you to sign this." And I looked at her and I said, "Oh, my darling, what happened?" She said that they were unable, that the money they had, it was cheaper for them to take their family of 4 all the way across to Canada than it was for them to pay the school fees of the children. How do you compute that? What do you want us to say? I quickly signed and released her to go. How do we, and this is what we have come to after 61 years of independence. I think everybody that has been in the administration needs to be blamed, because it's absolutely, it's unthinkable that while other countries are on a steady uprise, we are just going down. So I think, I don't know, how we got to this, it absolutely baffles me, because it is clear from the brain drain that we have the brains. We have just chosen not to apply them in the right direction.
Right. Let's get back to the studio. Dr. Kanu, as it is, something has to be done. First, the implications, and how do we tackle them?
First of all, we need to realize the fact that we are not doing the right thing.
In what sense?
Now, first of all, you could recall some months ago, in the heat of the pandemic, a sitting minister was saying that doctors can go. I mean, they can do. We have enough doctors. We need to tell ourselves the truth that we do not have enough doctors. If you look at the WHO classification, the WHO says that at least we should have 1 doctor to at least 15 patients. But in Nigeria, I don't think we have up to 1 doctor to 150,000 patients. That is how bad it is. So we first of all need to realize the deplorable state of our healthcare system. Right. And then, in solving the problem, we need to go back to the drawing board. We need to bring stakeholders together. In healthcare, that is why I was saying that healthcare is one of the richest industries in the world. We have the private sector. The private sector in the healthcare system in this country are making a lot. If some pharmaceutical companies tell you how much they make in terms of their profit per year, you'll be amazed. We have the public sector, of course. We have the social sector. Now, we need to be able to bring all these stakeholders together and say, look, this is our health system. How can we put hands together? How can we, collaborate to make sure that we bring a sustainable funding system for the healthcare system? On the part of policymakers, we need to make sure that we hold the government accountable to the declaration of Abuja Declaration. That at least we should be able to earmark 15%. 15% of our annual budget should be earmarked for healthcare. That is a first commitment from the government that will show Nigerians that the government is serious. And then we bring in the private sector. There are a lot of key players in the private sector. We have development partners. We have the Bill and Melinda Gates Foundation. We have the World Health Organization and other multilateral organizations that we can say, look, we want to see how we can strengthen human capacity within the healthcare system. And for us to do that, we need a concerted effort from all members, all stakeholders involved, so that we can have a pool of funds. We need to also work on our insurance system. The insurance system is not helping us. And I know that perhaps we need to also reconsider the mandatory health insurance system so that every Nigerian can be a part of it. If we have sufficient pool of funds, then we can have something that we can earmark for taking care of human capital development in the healthcare sector. Right. This is absolutely necessary, and we have to do it now. Like she said, it's not only doctors. In fact, I'm a pharmacist. Yeah. So I'll tell you that pharmacists have left this country in droves. Right. And we need to nip it at the bud right now.
All right. Let's leave the conversation here now. Dr. Nnamdi Kanu, as well as Dr. Alera Roberts, thank you so much for your time on the program.
Thank you so much for having me.
Thank you.